I worked as an emergency medical technician on an ambulance throughout the city of Chicago, and I really enjoyed the hands-on aspect of my work. And then when I did my general surgery rotation in medical school, I found that I really enjoyed being in the operating room, and I really enjoyed the immediate impact of what was capable with surgical intervention. I have one patient that I remember very vividly. She presented to the emergency department with a ruptured abdominal aortic aneurysm, and this is often something that folks don't survive, and they often don't even make it to the hospital. Ultimately, I was able to fix her aneurysm with a minimally invasive approach using a stent graft, several stents, and she left the hospital after several days and is now recovering well at home. When I saw her in the office for her first post-operative check, I shared a great hug with her and her family members, and she was so appreciative of the care I had provided. It really is why I do the work I do. It is often life and death emergencies that I'm dealing with as a vascular surgeon, and to be able to save someone's life, someone that means so much to her own family, is really rewarding. My name is Melissa Hetrick, and I'm a vascular surgeon, and my passion is getting patients back to their normal everyday life and back to their families.